Hi, my name is Alexandria Barut, and the study I did was called Effects of Music Therapy on Anxiety of Patients with Breast Cancer After Receiving a Radical Mastectomy, a Randomized Clinical Trial. So, the first thing we're going to be talking about is the research problem and questions associated with it. So, it has been shown that there is increased anxiety and stress in female breast cancer patients after receiving a radical mastectomy. Anxiety tends to be the most common and most prevalent psychological symptom associated with breast cancer patients, so they wanted to try and find a way to relieve this or control it. So there hasn't been a lot of information and research done about music therapy on anxiety with these breast cancer patients, so it's basically why we're doing it. The question was, will music therapy relieve anxiety in women with breast cancer receiving a radical mastectomy in the Chinese setting? So there are two hypotheses. So the first hypothesis was the experimental group will have decreased scores of state anxiety compared to the control group. And the second hypothesis was the treatment effect will change with follow-up time. So basically, if music therapy can decrease anxiety in breast cancer patients, this will help them to control their feelings, their motives, their goals, and any self-potential, leading to more successful rehabilitation. Okay. Then we have our model and framework. So the model we used was the Core, Care, and Cure model, and this was created by Lydia E. Hall. And core meaning the patient, care meaning the body, and cure meaning the nursing behavior. So in this study, core was the female patients with breast cancer, care was to reduce the anxiety, and the cure was the music therapy. She broke that down into two stages, the acute and the non-acute stage. So the acute stage was when they received the intensive medical care, and the non-acute stage was kind of like the recovery phase where they were learning and basically going through rehabilitation. Okay, then we have our variables, our independent and dependent. The independent variable was the nursing care with the music therapy, and the dependent was the nursing care and the anxiety of the women. There were demographic requirements and variables, so anything required was if they had to be female, 25 to 65 years old, with a pathological diagnosis of breast cancer requiring the radical mastectomy. Interventions, so we had two groups, the experimental group and the control group. The experimental group was allowed MP3 players where there was a downloaded music media library where they could pick any song they wanted to listen to that was in the library, put in some headphones and listen to it, control the volume and everything. They had to do this 2 times a day, in the morning from 6 a.m. to 8 a.m. and then at night from 9 p.m. to 11 p.m. Only in 30-minute intervals. So 2 times a day, 30 minutes in the morning, 30 minutes at night. The control group was given no information whatsoever about music therapy, and this was to decrease any bias. And they only received routine nursing care for their cancer and chemotherapy. Then we have our sample size. So in this study, there were 120 female patients with breast cancer. They realized they only needed 100 patients technically to detect the difference between anxiety scores, but they wanted to give themselves a 20% dropout rate, so a little cushion, just in case. So that's why they did 120 instead of 100. So basically there were 60 patients in the experimental group, 60 patients in the control group. Like I said, they have to be ages 25 to 65 with a pathological diagnosis of breast cancer requiring radical mastectomy. Patients who were excluded were if they were allergic to sound, voice, sensitivity of epilepsy, and basically if they didn't like listening to music or didn't prefer it. For the ethical considerations, so the study was approved by the Human Research Ethics Committee. Patients had to give consent. So all the patients received an explanation of the study and what they were going to be doing before giving consent. Then they had to give written consent before voluntarily participating in the study. Okay, data collection. So the instruments used were the Demographical Data Questionnaire and the State Anxiety Inventory, also called the SAI. Both of these were completed for the pre-test. The SAI was only used for the post-test, and there were 3 of them. The first post-test was the day before the patients were discharged from the hospital. The second post-test was when the patients came back from chemotherapy. And then the third was when they were admitted back into the hospital for more chemotherapy. Okay, the results. So basically, the experimental group did have decreased anxiety like expected. So the patients who received music therapy reported lower scores and lower anxiety for each post-test. So gradually, after each post-test, the scores kept getting lower and lower. So as time increased for music therapy, it led to decreased anxiety state. So basically, music therapy can be a good adjuvant therapy for females undergoing breast cancer treatment. Music has been shown to occupy attention channels in the brain, so it's very distractive, and it's a soothing auditory stimuli rather than a stressful stimuli like the pain in the treatment itself. All right, then we have our limitations. Okay, so it was self-reported data, which could be influenced by defensiveness, misrepresentation, and personal emotion. It was only quantitative data that was collected in the study. There was no physiological variables used, so music therapy on the physical aspects would need to be further studied. 4, there was the control group that only received the routine nursing care. And then the 5th limitation was that the patients with extensive radical mastectomy, also called ERM, were only a small part of the study compared to the modified radical mastectomy. All right, and then we have our implications and conclusions. So we can conclude that music therapy can be considered an alternate treatment for anxiety associated with these breast cancer patients. It was shown that life satisfaction and well-being increased in women living in China, and we can also use Lydia E. Hall's The Core Care Cure model as nursing practice for music therapy. Okay, then we just have the references, and thank you very much.